Two separate testosterone testing and supplementing companies tried to convince me to take TRT when I didn't even need to. So here's what you need to know about TRT, testosterone, and how to protect yourself. Testosterone has been getting a lot of attention in the media recently, and for good reason. T levels in men have been decreasing up to 1% per year since 1950. And the reasons, they're not clear. It might be increasing levels of phthalates or pesticides, BPA, which is a plastic found in things like receipts, or changes to nutrition and exercise. There's probably also a joke in here, something about driving a turbocharged 3-cylinder 1.6-liter engine versus a naturally aspirated American V8. In response to this, a lot of companies have cropped up. After all, there's a need for increasing the levels of testosterone in men. So they're testing and then providing the supplementation, the testosterone replacement therapy, or TRT. Now, I do sponsorships on this channel, but of course, before promoting anything, I want to make sure that my viewers can actually benefit from it. So I do the testing myself first. So two separate companies actually reached out to me and they sent testosterone sampling kits. So you prick your finger, you drip a couple drops of blood onto this card, you mail it back, and then they update you with the results. And based on those results, they'll tell you whether or not you were eligible for testosterone replacement therapy. Two separate companies reached out. I did two separate sampling kits, and these are the results I got. Now, little hint, these are nowhere near the results that I actually got when I did my own independent testing at a consumer grade lab, but more on that shortly. So these companies gave me a total testosterone of 539, free testosterone of 7, SHBG of 58.8, albumin 4.7, AST 31, ALT 32, and estradiol 28.4. Based on these results, my total testosterone is within normal range, but on the slightly lower end of normal. My SHBG, my sex hormone binding globulin, which binds up testosterone, and you see the total amount versus the free amount. The free amount is the amount that is unbound by SHBG and also not bound by albumin. My SHBG is quite high, so that's why my free testosterone is actually lower than the normal range. It's at 7. Normal would be around 8 to 25. But of course, you want to treat the symptoms too of testosterone deficiency, not just the labs, not just the numbers. So I got on a call with the doctor, and he asked me a few questions about symptoms, things like energy levels and mood and libido and strength. Nothing comes up as a even remote issue. The only thing I say is I've had some issues in the last several years of putting on muscle mass, but other than that, no, none of these are symptoms. He says, okay, based on your symptoms and based on your numbers, you're a strong candidate for TRT, and he prescribes me 50 milligrams twice a week, either intramuscular or subcutaneous, or 100 milligrams once a week. He wants to prescribe it to me for 6 months, and then after that, have me stop and see how I feel. Now, none of this seems egregious, right? But especially if someone doesn't have any medical knowledge, not an ideal situation. They're not asking things like, first of all, they didn't test for cortisol, and higher levels of cortisol actually inhibit testosterone production. They didn't test it, and they also didn't ask for things like, how are my stress levels? How's my sleep? Do I have sleep apnea? They didn't check for deficiency in vitamin D or zinc or magnesium or not having enough fat in my diet, because all of those things can also contribute to impaired testosterone production. Secondly, and way more importantly, the numbers weren't actually accurate. So they sent me 2 test kits because the first test kit, the results were invalid for whatever reason. Second test kit, these are the numbers. But I had my own testing done at LabCorp, which is where I normally get my labs done when my doctor orders them. And these were the results from a couple months prior. Very, very different. Total testosterone, 887, free 13.1. Don't have albumin or SHBG from that prior visit. So then I was thinking, okay, maybe my testosterone decreased because it had been several months and whatever, there's some fluctuation. So I went again to LabCorp within 10 days of that test that I did with this other company. And here's what I got. Total testosterone, 1,024, 13 free, SHBG 69.4, which is super high, and albumin 4.8. I thought, hey, still kind of strange. So I tested it again a few months later. Total testosterone, 891, 14 free, and SHBG of 55.8. Now keep in mind, I have tested my testosterone over half a dozen times in the last year or two, both before and after this company's test results, and I've never tested below 13 free and 830 total. The issue here is a very clear conflict of interest, because if you're one of these companies, you want to provide people TRT, because that's where you make your money. And in order to do that, you need to justify it with low enough numbers. So you are incentivized to not have accurate testosterone numbers, but rather sandbag the numbers and provide the user, the customer, lower numbers to then convince them to then get on TRT. All right, so lessons learned. The first would be measure your own testosterone from a proper lab. Don't go through one of these companies because of this conflict of interest. And if you do want to naturally elevate your own testosterone levels without having to go the pharmacological route, getting TRT, then look at things that are easily modifiable. So the first being strength training, which is actually very effective at increasing testosterone levels, at least if you're not training to failure, getting close to failure, but not to failure. It can elevate your T levels for 24 hours, sometimes even up to 48 hours in some people. The next would be sleep optimization, and we've talked a lot about that on the channel. You can watch some of the videos up here. And the third would be a balanced diet with sufficient amounts of both protein as well as healthy fats. And speaking of lifestyle optimization, I'm grateful for today's sponsor, Element. I've been using their product daily now for the last 2 months, first upon waking and then also with vigorous exercise, and I'm loving the way that it makes me feel. And on colder days, I'm able to enjoy Element Hot. The chocolate chai flavor is delicious. There are certain levers that are low risk, high reward that would be silly for us to not use. Things like improving our sleep, or exercising regularly, or even optimizing our hydration. These factors have outsized benefits compared to the inputs that they require. And it's not just ultra-endurance athletes that need to worry about their hydration either. Depending on your job, you may be at much higher risk. I know when I was training back in medical school and residency, there were many times when I was dehydrated, and also my partner, who is a nurse, is also facing issues frequently with dehydration. In fact, Wang et al. In 2021 found that 91% of surgical residents reported dehydration symptoms such as headache, constipation, and orthostatic hypotension, which is when you stand up and you experience that reduced blood pressure and lightheadedness, when they were in the OR. And 71% of these residents believed that dehydration frequently impacted their performance. And there's research to back this. Even mild dehydration, we're talking 1 to 2% loss of body water, can affect your cognition and performance, and water is only half of proper hydration. You also lose electrolytes, mainly sodium, through sweat, respiration, and of course urination, and your optimal cognitive performance requires that you replenish them. Having sodium and electrolytes with your water can actually boost absorption from the gastrointestinal tract at concentrations up to around 200 milligrams per fluid ounce. This means that for the same fluid volume, the electrolyte solution is actually more hydrating than just plain old water. To get these benefits, you could add half a teaspoon of salt to around 16 to 32 ounces of water, but it tastes pretty nasty. I've tried it myself. And a big part of the battle in hydration is just making it enjoyable enough, pleasurable enough, tasty enough that you want to do it. When it tastes good, you're far more likely to actually want to drink it. Check it out for yourself, and if you don't like it, they have a beautiful, no questions asked refund policy. You don't even have to return the product. Visit drinkelement.com/Jubal to receive an exclusive free gift when you use my custom URL for both new and returning customers. Stay salty, my friends. All right, so next you want to understand what are you looking for with regards to symptoms of low testosterone before just blasting yourself with TRT. Things like muscle mass and ratio of lean mass to fat mass, things like libido, sense of well-being, bone mineral density, and so on. If you do have low testosterone, you're also going to want to look at other markers of metabolic health. How is your glucose disposal? You can measure that with OGTT, your oral glucose tolerance test, or hemoglobin A1C, or fasting glucose. You want to look at your blood pressure, your total cholesterol, HDL, LDL, triglycerides, etc. The reason being, for those who have low testosterone and metabolic dysfunction, TRT has been proven effective to improving those metabolic markers. And finally, if you are considering TRT, then know the risks. Now keep in mind, when we're talking about the risks here, these are with regards to physiologic levels with testosterone replacement therapy. We're not doing the super physiologic levels with bodybuilding and et cetera, where they're using really high doses of T.
Test, D-ball, it's just basic stuff.
The first being erythrocytosis. You're making more red blood cells. Your blood is getting thicker. This is one of the main things that you have to look out for. Next would be fluid retention, which is actually not very common at physiologic doses. Next is liver toxicity, usually just limited to oral agents, which is not really relevant because generally we're doing IM or sub-Q. Sleep apnea, pretty infrequent. Gynecomastia, which is a side effect of increased estradiol. And you can actually counter that with aromatase blockers, things like anastrozole, which is going to prevent the testosterone from being converted to estrogens. Skin reactions tends to only happen with the patch, otherwise not really heard of. Acne and oily skin. Again, this is more of supraphysiologic doses rather than regular physiologic doses. And testicular atrophy and infertility.
Do steroids make your balls shrink? Yes, they do. But is that really a bad fucking thing?
And then, of course, testosterone atrophy and infertility. This tends to happen more frequently in durations of 2 years or longer. So if the patient is concerned about testicular atrophy and their fertility, they really should not be on testosterone replacement for periods of 2 years or longer that is uninterrupted. You want to interrupt that throughout. Many are also concerned about cardiovascular risk as well as prostate cancer risk. So I did a bit more digging here, and here's what I found. So when it comes to increased risk of cardiovascular disease, there's really two main studies that have pushed the public narrative, and these both came out in the early 2010s. The first is this 2013 study. It's pretty poorly done. So poorly done that in this study of men, 10% of the patients happen to be women. And even in the data, they initially showed a reduced risk of cardiovascular events in the men that have low testosterone who received TRT versus those who didn't. But the authors actually concluded the opposite, because that TRT increases the risk because they did some complex statistics controlling for more than 50 different variables. When you're trying to control for so many different variables, the data becomes less clean. Overall, adjustments tend to help the data, tend to help you separate the signal from the noise. But when you're doing this many different adjustments, you're taking it too far and you're compromising the actual validity of your conclusions. Now check this. In response to these errors, 29 international medical societies and more than 160 physician scientists from 32 countries petitioned JAMA to retract this article, citing gross data mismanagement and contamination that rendered the study no longer credible. Yet, the study still stands. And the other study was this 2014 study, which also had some major flaws. So essentially, they looked at the moment that someone got a testosterone prescription and said, what is the risk of an MI for the subsequent 90 days? And compared that to the 12 months prior of having an MI. Now, the big elephant in the room for the study is that if someone had an MI, a cardiovascular event in the last 12 months, how do you control for the fact that most of them are not going to even be eligible to receive testosterone replacement? It wasn't randomized, and the selection criteria was pretty whack. There were some other studies that also had some pretty significant limitations, but we're not going to dive into them here. And now going on to prostate cancer risk, I'm not going to dive into all the studies here, but similar conclusions, which is that we definitely need more robust evidence to really have a conclusive statement as to whether or not testosterone replacement therapy increases, decreases, or doesn't change the risk of prostate cancer. And then, of course, also the aggressiveness of that cancer. And that's it, my friends. Check out the link below to check out Element and let me know your thoughts on testosterone replacement therapy. See you in the next one.